My name is Dr. Jennifer Harrison, and I work as a certified athletic therapist, chiropractor, and certified BodyTalk practitioner in a multidisciplinary clinic in Calgary, Alberta, Canada. I started studying BodyTalk in 2001, and in 2007 I became a BodyTalk Access trainer. Also in 2007, Morag Bromfield, a certified BodyTalk practitioner and instructor from South Africa, became the IBA Vice President of Access. However, Access has grown extensively worldwide, so in 2009, I was asked to join Morag to become a co-vice president of Access. Dr. John Veldheim, the founder of the BodyTalk System, had a vision that he wanted BodyTalk to be accessible to as many people in the world as possible. There are many places in the world where little or no health care is available. Even in Canada and the United States, there are often long wait times to see a medical doctor, or it's cost prohibitive to see a healthcare practitioner. So in 2005, BodyTalk Access was created by Dr. Veldheim and Sylvia Muzniks, who is a senior instructor with the IBA. BodyTalk Access is a one-day course for lay people as well as professionals that involves learning 5 basic yet essential BodyTalk techniques. These techniques include the cortices technique, which helps enhance right and left brain communication, brain-body communication, as well as to decrease stress. Switching helps to decrease stress levels while increasing your tolerance to stress. The hydration technique helps the cells in the body to utilize water effectively, and the body chemistry technique helps to balance the immune system. The reciprocals technique helps to balance energy reflex points in the Wei Qi, or the electromagnetic field that is close to the skin. This helps with many things, including muscle and joint functioning. It takes a day to learn how to do the techniques and to learn why they work. However, the actual Access routine itself can be done in about 10 minutes. In addition to learning these 5 basic techniques, you also learn something called Fast Aid, which can be applied in an emergency situation to augment standard first aid procedures. When I teach Access, before I start teaching the techniques, I always get my students to do a physical evaluation. I ask them to rate their energy levels, any pain or discomfort they may be feeling. I also get them to check their range of motion in their necks and their backs. And then I teach them the cortices and switching techniques. Then we reevaluate. We also do another reevaluation at the end of the day. It is always amazing to see the actual physical changes that occur during the course of the day. Sometimes the changes are subtle. Perhaps someone's headache becomes less, maybe goes away. Sometimes the changes are quite dramatic. In 2010, one of my students was about 4 months away from having knee replacement surgery. She had suffered with severe osteoarthritis in her knee for many years, even though she was only in her early 50s. During the course of the day, her knee range of motion increased by 10%. Her pain decreased from a 7 out of 10 to 4 out of 10. And also her back range of motion in forward bending increased by about 15%. And she reported that that was the most range of motion she'd had in years. After her surgery, she did BodyTalk Access routine daily and healed extremely well and got more range of motion in her knee than even her orthopedic surgeon expected. I do Access daily on myself. Also, I'll do the cortices technique, which is the only technique that can be done as a standalone technique, and I'll do that about a couple of times a day. I find it helps me to get focused. In addition to treating patients and teaching Access, I also teach manual therapy courses to athletic therapists and massage therapists in Canada. Life can get pretty busy at times, and I find the cortices technique helps me to switch gears if I've been doing coursework, preparation work in the morning, for example, and then need to now focus on treating my patients in the afternoon. If it has been a really busy day at the clinic, then it's nice to do cortices technique to unwind, and then I can relax and enjoy my evening. As of June 2011, there are 213 Access trainers teaching in 43 countries around the world. To date, there have been approximately 26,000 Access students, and those numbers continue to increase daily. Access is truly an amazing technique that anyone can use to enhance their own health and well-being, as well as helping to take care of their family and friends in only about 10 minutes per day. Also, teachers have found it helpful to have their students do Access in the classroom to improve learning and behavior. Other healthcare professionals have found Access helpful because it can enhance other forms of healthcare. And Access has also been helpful with sports teams to enhance performance or to help deal with injuries. Access is not meant to replace any form of healthcare, including full body talk sessions. However, Access is an incredibly easy and powerful way to improve the health and well-being of individuals, families, and communities around the world.